Hello, everybody. This is Brian Dowd. I want to go ahead and be respectful of everyone's time and get started right at 1 o'clock today. I want to thank you for joining us for the June EVV Public Forum. I am the Deputy Executive Director over Policy Operations and Compliance at the Department of Community Health, and I've been working on EVV for about 3 years now. So we always start our presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchase, and oversight. So what are we going to go over today? We're going to do a little bit of status updates and timelines. We're going to talk a little bit about just some things that we know we're getting a lot of questions on, or not even a lot of questions, but we are getting questions. So we're going to do an EVV claim submission update, some information on that. We're going to talk about self-directed members and what's upcoming for them. We're going to give you an update on key fobs or fixed devices. We're going to walk you through some common issues and questions. We're going to go over the providers using a third-party vendor, give you the resources for EVV call center, Townhalls, again, that third-party vendor update. And then at the end, as much as we are able, we will do a Q&A session. So where are we? So claims, the most important thing, because I've gotten this question a couple of times. I was actually out of the office last week. So for those of you who are waiting on a response from me, I really do appreciate your patience. I will be getting back to you as soon as I can this week. It's been a really busy week, but I am working through all of the emails from last week. So claims, I got this question a couple of times last week and got it yesterday as well. The claims system is available, so you do not need to wait to start submitting claims. You can do that right now. If you are a provider and you have all your claims information in the system from a scheduled visit, it can be sent over, and TELUS will send it through our interface to Gainwell, which is the MMIS system, or what you guys know as GAMIS, and it will process that claim. Training continues to be available. There's a lot of training resources out there. We've talked to TELUS this week about kind of their ongoing weekly training session, including an open-ended just Q&A training session where they have every week that they just answer any questions you might have. So we'll talk about a little bit about that today as well. And we really, really encourage you to take advantage of all of the resources that we have. I get a lot of questions every day. I probably get 300 or 400 emails that come into my email box every single day. And 2 or 3 of them today, I was referencing people back to our EVV website because the answer for their questions was literally in bold on the first page of our website. It had exactly what they were looking for as far as what codes were included or not included, and it was very plainly on our website. So we really encourage you to look at our website, look at our state solution, because all the information you need is usually out there on the website or included in part of one of the trainings. Another important point we want to let you know is a status update that TELUS is currently rebranding to NetSmart. So TELUS is now NetSmart. So you will see those names interchangeably. I'm doing my best to start to move away from calling things TELUS and start calling it NetSmart, but I'm struggling. It usually takes me a little time before I am able to do that. So we continue to be in the midst of our recruitment campaign. We have several providers that have not registered yet. We're doing daily calls, we're doing reach outs, and we're continuing to do refinement based on the questions that come into the EVV call center, the NetSmart call center, Conduit call center, and from every other avenue that we receive. We are still targeting July 1st just a couple of weeks away now, actually 2 weeks away and 2 days, 2 weeks and 2 days away from mandatory claims processing. So we are still targeting that date. We do have some go, no go decisions that will happen over the next couple of weeks. And we always are very thoughtful about our decisions to go live. We don't want to negatively impact our providers. But we are moving forward to mandatory claims processing for the EVV system. Next slide, please. Again, claims start today. If you're using the state EVV solution, if you're using the NetSmart solution, there are 2 checklists that are available, and this presentation will be available on the website later today or early tomorrow if it's not already out there. So you have a phase 1 checklist that is available and a phase 2 checklist is available. If you go through our checklist that we've provided for you, you should be in really, really solid shape associated with EVV compliance. So I want to give, because this has come up, and you guys probably know, a lot of you guys know me now. I can be a little bit of a slow learner. So I want to go ahead and do this slide to give you updates for self-directions, because I've heard, well, we really need self-direction targeted here in every single thing we do. So we're going to do that. So self-directed updates. You can stay on this call if you choose to stay on the call and you are a self-directed member. Feel free. We encourage everybody to participate in all of our communications and training. However, we have targeted town halls for you by your fiscal intermediary. And those will be this week and next week. The first one is with Acumen on Thursday. We are providing resources, because many of y'all have told me you don't have resources with your fiscal intermediary. Well, you do now, so you're not going to be able to say it to me anymore, because they're provided right here on this slide for you to use, and we're going to make sure you have it on our website if you do need it. And thanks to the good work of Brittany and Lee Clois and some of our folks, we've been able to put this together for you. So you have direct EVV contacts for each of your fiscal intermediaries, and you have upcoming town halls for each of your fiscal intermediaries. And I want to be clear, as many of you have requested, they will be available to participate on the town halls, and they will be presenting with us on the town halls. So you can, again, if you are a self-directed member, you can choose to stay on the rest of this call, or you can drop off and go to your targeted self-directed meetings. Just please do attend the self-directed meetings. Of course, we will make those slides available for you as well, and the recordings available for you as well. So you will be able to get it. If these times don't work for you, you'll still be able to get all the information that we have in those self-directed meetings. Okay, so one of the other important updates that we need to do with you guys is about key fobs or fixed devices. Initially, for the first year, 2 years, we had been talking about providing a fixed device or a key fob for any person where their workers didn't have a cell phone, a smartphone, and they did not have a landline in their house. It should be a pretty rare scenario that somebody has a worker that doesn't have a cell phone, or you don't have a landline in your house that can be used as well. Because that would just be a health and safety issue if nothing else, right? Like, how would you call 911 if you had an emergency, or if you're going out with your member, how would they contact somebody that was emergent? But in the scenario where you don't have, your worker does not have a smartphone that they can use to download the app, you can go onto our website and utilize IVR for telephony. You have to fill out the form. It should be pretty quick. We do some follow-up with your providers. We're a little behind in authorizing them, but we are reviewing them, and we will authorize them here this week, early next week. We'll get them all worked through. We don't have that many. We have less than 20, to be honest with you, that have been requested. the whole time that we've been available, which is about 3 months. We have less than 20 IVR requests. But if your workers do not have a phone, you can request the use of IVR in the member's home. Now, let's say you don't have a landline and your workers don't have a smartphone. Fine, I'm going to provide an additional resource. You can get your members, or you can get a free phone. You just go to this website, thegeorgialifeline.com, and you are afforded a free phone with free data, way more than enough to operate EVV every day. It also has texting and call capacity. You can leave that phone as a member in your house and use it just for your aides to clock in and clock out using their own unique ID and password. So if this is not something that DCH owns, this is a federal program that we at DCH are working with to encourage our members to have access to phones. Because like I said before, what do you do in an emergency if you have no phone? How do you keep track of your doctor visits if you have no communications? Well, we got an answer for you, and that is GA Lifeline. You can get a free phone to your house, and we can use that phone as a smartphone for your EVV. Next slide. So some common issues and questions we want to go over real quick. So this is, again, for more traditional providers. So again, self-directed folks, we welcome you to stay on, but if not, you might want to just go to your own specific targeted self-directed meetings. So it's very important that your payer provider number is equal to your Medicaid ID number. That's what we are looking for. We're looking for that Medicaid ID number. Different location, services, and waivers have different ID numbers. So you can have at 2 Peachtree Street, which is where our office is located, you can have an ID for comp, you can have an ID for now, and you can have an ID for ICWP, or you can have an ID for GAP and source. So you can have multiple IDs at the same location, and you will need to complete the registration for each EVV applicable Medicaid ID. You don't need to register an ID that is associated with adult day health or community residential alternative, but you do need to complete those ID for personal support services and community living supports. So this is exactly what I just went over, but there is one really important point on here, and you guys know that I have a couple of points that I didn't go over. I'm not the best with sticking to slides. So each location, you need to know what the zip code is that matches to that location. We'll provide call center resources that are available for you, but you can also go on MMIS and search through your provider ID, and it will give you the address with that zip code. I haven't done it myself, but you can call MMIS. They have assured me that there is that capacity in provider enrollment for you to look at what all your IDs addresses are that includes the zip code. Make sure when you are assigning your short name in the administrative portal, which you're going to update after you register, to identify locations, services, and waivers. So be specific enough so that you can navigate through your additional IDs. So like if you have source 2 Peachtree Street, ICWP 2 Peachtree Street, or ICWP 2 Peachtree Street, ICWP Twin Towers, ICWP Atlanta Zoo. That gives you 3 different locations that you might have for ICWP that you can scroll through. So just be careful with your short name so you're not going, which one of these are different, or naming them the same things or so close to each other that it's difficult for you to remember which is which. So once you register, prior authorizations are loaded from the MMIS system. We get those prior authorizations from different places, and now in comp, We get them from the Beacon system. We may get them from the Alliance system. We get them from all different places. We may get them from, well, I can't remember the DAS system, but we get them from all different systems and they are put in. Employees will need to be added via manual entry or input. So you got to bring in your employees into the system. If you have any data that is incorrect, because several of y'all have contacted us about, hey, I'm not seeing this member, I'm not seeing this prior authorization, we're going to give you the call center number to call. I'm going to encourage you to go to the conduit call center number first. A lot of you guys are directly contacting me or our EVV mailbox, and you've probably told by now, I'm just forwarding your information to the call center. I'm forwarding it to the conduit call center and saying, please respond to this request about missing information. So I don't want to delay y'all by a day or 2 days while I'm reading your emails. Go directly to the source first. You can always contact me if there's issues after you have called the call center or you can't get it fixed through the call center. But please do due diligence first and allow the call center to try and correct your issues first. Okay, data, it's important when you are registering your sites that the data access varies by roles, and roles are assigned by the administrator. If you have a role other than an administrator, then you're not going to be that super user. You're not going to have access to all the agency data in your dashboard. If you are the only administrator and you then change your role to biller, like you go in and say, okay, I don't want to be the administrator, I'm a biller, then you're not going to be able to change yourself back because you've moved yourself away from being that super user. Each location and service registration, so all of your IDs really need to have an administrator role. That administrator role, again, is that super user who gets to do everything in the system. So we just want to kind of go over a little bit of what the other roles are. There's the provider administration. This role allows the user to view and edit information. This is that super user. They have access to everything in the system. There's the biller. That does claims functions only, visits, work lists, claims review, and prior authorization. You can combine that role with other roles except monitor. So then there's the aid role. That aid role is for the personal support aid, and they will have access to information on their EVV app, but they won't have the other super user biller or provider administration. That's the worker. And then you have a provider view only. This is a view only information. It will not allow you to make any changes, and it's not to be used in conjunction with personal support aid, because personal support aides are supposed to be able to go in and clock out and actually use the system. So you don't want them to have that view only capacity. Okay, at this point, I'm going to pause and turn it over to Joe Schnurr. He's the Chief Customer Officer at NetSmart, and let him go over task scheduling demonstration.
All right. Hey, thanks, Brian. As Brian's been going over some of these common errors, the whole goal here is to react to some of the feedback that you've all given us. So what we're trying to do here is to share with you how you do certain things or certain pitfalls that some people have fallen into with a system that they're just learning. And so that's our goal today, is to go over these kind of common issues, if you will, or challenges. And this scheduling tasks is one of them. And so what I'd like to do is go off the PowerPoint and flip over to my demo. So give me a second and I'll do that. Okay, are you able to see my screen, Brian?
Yes, absolutely am. Thank you.
Okay, great. So I am I'm logged in as an administrator, so as that super user. Um, so for you administrators out there, this is the portal you're used to seeing. I am in a demo environment, so the data is demo environment, demo data. And I am going to show you how to add tasks. So you can see over this left menu bar over here. By the way, if you want to ever reduce this menu bar, you hit this little icon up here in the left.
Hi,
And
Joe.
yes.
I don't see the portal on your screen.
Yeah, Joe, we're seeing your file display. So we see kind of like your desktop organizing or like your file organizing system.
Oh, okay.
But your cursor was moving in the correct place. So
Sorry, I should have said that.
Let me try this one. How about now?
yep, that one, that's definitely it.
Okay. So let me start over again. So again, I'm logged in as an administrator into the portal. Over here on the left-hand side is your menu bar. Right now it's in a collapsed mode. If you want to expand it, you hit this little icon up here in the upper left, and then you can actually see what each of these are. So to show you how to set up tasks, I'm going to go under the provider agency button. I'm going to go under the payers button up here in the top. So you can see details, payers, contractors, override rates. So I'm going to go under payers. I'm going to select DCH as the payer. And then I'm going to page down, and then I'm going to see the services that I'm set up for. And again, this is a demo system, so your services may look different. And then you can see it says the number of tasks that are set up for each. So you can see this first one, I have 7. Personal care, I have 4. And these other 2, I don't have any set up. So I'm going to click on this button on the right-hand side. See these 3 little buttons? If I click on these, it opens a little menu. It says Manage Tasks. So I'm going to go ahead and manage tasks for home health aid. So I click on that. It opens it up. It gives me the service code. It tells me this is home health aid. And then we have default tasks. You can see there's actually 64 of them in the parentheses here. So we try to make this easy and giving you basically the most common tasks that providers have shared with us that they use. Now, if you go through the list of 64 and you don't see a task on here that you use, you can always add one right here by this button, add. You can add another one, and then your list will say actually 64 because you've added your own. Now, if once I go down through the list, if I want to add any of these, it's as easy as clicking the button. So that means the task will now be completed for this service. If I unclick it, it means it will not be. So let's click one. Let's see. Let's click hygiene. So we added hygiene. These other ones that are already selected, those were some of the 7 that were already selected. If you remember, for this service code, we had 7 tasks already selected. So now I'm going to page down to the bottom. I got to hit save. Don't forget to hit the save button. So hit done, save. Okay, now when I go to schedule a visit, so I'm going to just walk you through, for those of you that have scheduled a visit, this is the process that you walk through. I'll just use myself. And these are the tasks that are set up. And you can do custom tasks. And then when you select the service code, it will automatically select the tasks that are set up. And if I'm setting this visit up, and in this case, I'm setting it up for myself as the aide to care for Betsy here. And if I know that in this visit, I don't need to do the laundry, I can just unselect any or all of these tasks. And then whichever ones I keep selected, those are the tasks that are going to show up on the mobile app in the visit. So again, if I unselect laundry, it will not show up on the list. So hopefully that gives you an idea of how you can adjust your tasks and then which ones are available in the or in your system when you're selecting it for each specific visit. So I'm going to stop sharing and flip back over to the PowerPoint.
Hey, Joe, while you're swapping back, I know that's probably covered in one of y'all's trainings. Could you let us know which training that you cover that one in, if you recall?
Yes, we covered that in the administrative portal training.
Perfect. Thank you.
Sure. All right, let's see here. Okay. Are you seeing the PowerPoint again?
Yes, sir.
Yep.
Okay, great. All right, so I think we covered this task. And again, if you have any questions, just let us know. Back to you, Brian.
Great. So let's do some common issues and questions. One of the questions that we've got in is about what about offline when they don't have, there's not coverage, there's not cell coverage. What your aide will need to do is they'll need to sign in from a place where they have Wi-Fi or cell service. Then when the Wi-Fi or cell service is lost, then the data continues to store in offline mode. And it can store in offline mode up to 12 hours. But you need to make sure that you've logged into the system, not checked in for the visit, but logged into the system before you go to the offline mode. So if you know you're going to a member's house and they don't have any cell coverage at their house, which a couple of y'all have contacted me about and said, hey, my member lives in the mountains and there is no cell service there. Just make sure before they go that they log in so that it can continue to work in that offline mode. That's it, Joe. So I've already seen this question in our chat box. I was checking out some of the questions while Joe was going through the tasks. Retroactive Medicaid pending billing. And I'll give you the question that somebody asked, because this is part of what the answer is, because some of y'all have asked me about this. What do we do when we have CCSB QMB member services? They don't show up in the system until they get Medicaid approval. Can we provide services? Are we going to able to retro bill? So in some waivers that the person, we start services while the person is going through the DFACS authorization process for Medicaid eligibility. We call them different things. Most commonly, it's PMAOs. And they are folks that are going through that eligibility process, right? So the member won't show up onto the TELUS system until the member has a current prior authorization. Once they have that prior authorization, or if they have a prior authorization, you can schedule those visits within the EVV system. They'll stay unmatched if the member is known until you release them, but you have to have a current and active PA in order to complete a visit. So if your member doesn't have a current PA, you can still schedule it. But if they're unknown altogether with no PA of any kind, and they're not known to the system, and they've just been sitting out there forever as a QMB member, what you'll have to do is you'll have to document that on paper until they're approved by DFACS, the Division of Family and Children's Services. And then once they are approved, you'll be able to retroactively go back in and put in those visits for the member. So this is a question I think we also got in the chat box, which is, do I need to register for the TELUS solution if I'm using a third-party vendor? Yes, it is required for you to register and complete the TELUS claims console training and register for the system. And you should begin to submit those claims as soon as possible. We have 2 checklists that are available for this as well. You can go onto the DCH EVV website right now, and they are available on the website under the third party tab. Or again, we will post this presentation so you can use these links either later today or early tomorrow. They get these presentations posted pretty quickly. Thanks. So again, I said before, I really want to encourage everybody to utilize the Conduit call center before reaching out to the EVV mailbox or to me personally through my website, or there's really no reason for EVV for you to reach out to, say, the Beacon system for DBHDD, because this is a service. EVV is something that is managed through the Department of Community Health. So I want to make sure you're not spinning your own wheels and not getting anywhere with your questions. So it's really important that you go to these resources. The phone number is 833-701-0012. The email address is gaevvsupport@conduit.com. And there's also the available website where you can chat with somebody about what your question is. We also have on our DCH website a cheat sheet on how to reach out and who to get in touch with, and it has all these resources as well. So you can go right now to our website and get this available information. Okay, so what's upcoming? We have, again, the self-directed town halls on Thursday. We have this presentation tomorrow night. The Acumen self-directed town hall is from 6 to 7. We wanted to be respectful of people's time and do some variations as much as we could. We have a continuum town hall from 4 to 5, and we have a public partnership town hall from 9 to 10 on the 24th. So Thursday, the 22nd, which is Tuesday, and the 24th, which is next Thursday. We will be doing town halls in July and August as well, as we have done since November. We've been doing these town halls since November, and we'll continue to do them in the next couple of months so that we can address your feedback and the Q&A that we're seeing over and over again. Now let's talk a little bit about where we are with the alternative EVV vendors. I hope it doesn't have animation. So this is a new way of doing some slides associated with that. And I don't want to mess up people's names, but all the way over here to the right, we have one that is fully through the process and in production already as a third-party vendor. We have a whole bunch more listed here that is in pilot, which means they're essentially able to start sending over stuff. They're working through any issues. So they're moving to the final stage right now. We have even more that have testing in process. So all these folks here have testing in process, which is quite a few. Then we have some that are in develop. So they haven't started testing, but they've started getting the the information together to begin the testing, making sure everything's matching up. Almost as many of those that are in testing and process. We have 4 that are still in the contracting standpoint. They've contracted, but they haven't started moving forward yet with the development to get it all connected. And then we've had some initial contact with 3 other providers that are working forward to maybe get started with the contracting and get into the development process. We do have some others that have declined integration. And those are 1, 2, 3, 4, 5, 6, 7 down here at the bottom. It's very important if you have any of these providers that you reach out to these providers to talk to them, because you're going to need a plan. And if you are paying for their system, you will, if they're declining integration with us, you will need to use the state-sponsored system and not their system. Next slide, please. Okay, so we're at the end of our presentation. So I'm going to go through the Q&A. I can see it pretty good here. I will ask that you make sure you put your information in the Q&A and not the chat box. So I just want to ask you to do that for me, please. All right. So first question was just good afternoon. Thank you for starting with a good afternoon. I always like that. Second question is it possible to have a scheduler role in the system? The person should be able to create users and schedule them with clients. There's no reason to give an employee administration role to complete these tasks. Joe, do you want to talk about the different roles again?
Yeah, I think the question, Brian, is about could we create a new role with different access? So I think we could definitely take that offline if that's something you want to pursue.
Yeah, it's something we can look at. We probably won't have anything, because that's a development. That's an ask from our provider community. So we'll definitely look at it and see if there's something we can do there to accommodate. Mm-hmm. The next question is, currently the system shows top 20 members and users. The request is to allow to see all the clients and users, not just top 20. I don't know if there's a different way to configure that, or that's just the limit that we have in the system.
I think they're talking about when you go to the members page, it has, I think it defaults to 20, but I thought there was an option to select more than 20. There's like a little drop down at the bottom of the page that allows you to look at more than 20.
I thought so too when I was looking at it. So what we'll do is we'll go through this and we'll do a written response to that as to whether or not there's a way to get more showing there. I answered the question about CCSP and QMB, so I'm going to move forward past that. How do we, so if you have, the next question is about missing members in the database and retroactive billing. So that's very similar to the other question that we just talked about. This question does say that there are some missing members and you've called the call center and filled out a spreadsheet and it hasn't been resolved yet. So we'll follow up and we continue to monitor the information that is in the spreadsheet. It's very important for you guys to check and make sure if they are on MMIS, they should be in the NetSmart system. So we will check on that, but you guys make sure that they're not only in the MMIS system, but they're assigned to your ID and the proper ID you are expecting them to be signed to before you send us that question. A lot of times when we're going in, we're saying, oh no, that member isn't on this ID you're looking for. You need to go to another ID and see if you see them. And we're quite often able to match up that member to a different ID for folks. So this is a call center question. If somebody has an open ticket, do we have to go through the 15 minutes of credentials, or can we please just be able to use the ticket number to reference the previous call? We'll certainly discuss that with our call center staff and the administrators for that. That's another take-back issue for the Department of Community Health as far as process improvement goes. The next question is really about the geofencing. It's asking what is the maximum allowable distance from the member's home. I'm not going to give you that information. I've been asked that question 4 or 5 times now, and I'm not going to give you the geofence information. It's important to know, and I appreciate your question here, is that sometimes the distance appears to be off by 70 to 350 feet from the target location. And I want to be clear, nobody at the Department of Community Health is going to be sweating 70 to 350 feet. Nobody is going to be like, oh, well, you know, it shouldn't have started. They were 70 feet apart. Not only that, we understand at the Department of Community Health that the start place may not always be at the member's home. We've said that for 3 years now, that we understand that CLS can be a community service, right? What we use the EVV information is data analytics. If you are clocking in 14 miles away on the middle of 285, we may have questions about why a service started on the middle of 285 on the way from, you know, to the member's home. But that is much, much different than being 350 feet away from the member's home. Again, if the member is at the pharmacy, you may pick up the member at the pharmacy, or you may start the work for the member at the pharmacy. You may start the work or end a shift at Adult Day Health and not the member's home. We are aware of that. And we have consistently been saying for 3 years that the system will accommodate that work. So I don't want people to be worried about that. As long as you are not committing fraud, you have no problem. Your documentation shows what's going on, and we can clearly see the reason why the service started and ended at a place that was other than the member's home. How is it handled when the member's address is not in Google Maps and GPS location is not found in TELUS? I would have to see an example of that. We would want to see an example of when that happened. The next question is, after July 1st, will we be able to bill for PSS services prior to July 1st on the MMIS portal? The answer to that question is yes. Are tasks required for caregivers using third-party EVV vendors? You should be documenting tasks. So let me just say that. That is a requirement of the program. It's not just a requirement of EVV. We need to know what the daily tasks are. So if it's not documented in the TELUS EVV system, and it should be in your third-party EVV vendor, if it is not there, it should be on paper for auditing purposes. Again, another question about members that are in TELUS and having called the call center and not getting a response. So we will absolutely positively follow up on that following this call. If you have, the next question is, you've decided to go with a third party. We've talked about the need to register. So yes, you will need to be registered for our system. So that was included in this email. So please, in this presentation. So please just utilize this information for that. If we already have a system that tracks tasks, do we need to move them onto TELUS? If you are using the TELUS system, you will need to document the tasks that are in the TELUS system. And yes, tasks are a requirement of the program. They honestly always have been, guys. It's always been a requirement to be documenting your tasks. The next question is to show us how to complete scheduled visits. I think we have a training that is available just for that. So let me ask Joe if do we have a link for that specifically on our website, or Brittany, that we can point people to for the different trainings?
Brian, yes, I can post it. I have posted it once, the TELUS solutions trainings in the Q&A, but I'll go ahead and post it again. But that would
Great,
include all trainings. Mhm.
Thank you. So there is a thing in the Q&A chat, and I'm looking at it right now, so thank you, Brittany, where it says all TELUS NetSART solution trainings are available, and it gives you the link, and Brittany's gonna do that again. So you will have those links for that training and this training. When you do claims, will each task be released for payment? Well, yeah, the task will be the tasks are part of the unit that you're there to deliver services for. So that task is your documentation that you've actually been doing work associated with PSS. So that's why you're doing the tasks, because community living service or personal support services is support for the member for their activities of daily living. It is a service we provide. And those 60 whatever tasks that Joe went through, or others that you add, justify you being there and getting paid by Medicaid. That's the whole purpose for them to be there. Like we don't pay just for folks. We're paying for a medical service, and that medical and service includes those tasks associated with activities of daily living. You should, again, this is probably 10, 15 questions. Guys, you've always should have been documenting the tasks that you are doing on a daily basis. I'm not sure how we were completing notes without indicating what the tasks were that you were doing. So it's a little concerning for me that that hasn't been being done in the past, if it hasn't been. You want to, the next question asks about putting, sorry, that's my phone. Let me turn this down. So the next question is about utilizing IVR for your whole company. So we don't do blanket authorizations for IVR. That's not something we do. We look at IVR literally on a member by member, provider by provider agency. We do not approve IVR for convenience. And that is in the instructions. We approve IVR only in the case where there is no phone that is available for the worker to use. And we do verify that, and it will be subjected to auditing as well. If you do have PAs that are showing an error, please make sure that you are calling the call center resources that we gave you so they can follow up. If the call center does not respond, you are more than welcome to call. Please give the call center an opportunity to work through your PA issues. You can have 2 different PAs for the same member for a year. That's very typical, that there is one that ends and one that starts, or crossover. Some programs authorize service by individual specific lines. So there may be more than one PA for that member. The next question is it wise for the provider to enter the PA on TELUS because it gives the option to override and enter a PA for the member, or should we wait and allow the call center to the PA for our members who have no PA on file? I would tell you to wait for the call center and give the call center an opportunity to get it fixed first. I don't want you doing double work. And we need to look and make sure what's going on with that PA and make sure there's not a larger issue associated with the PA. So I've gotten this question a bunch of times. If you're using another software, right, you don't also have to update it in the NetSmart software. But you need to make sure that your third-party system has the ability to capture tasks. And if it doesn't, you need to be documenting what tasks you are performing during the day. That is a proper note. So I'm going to really request that everyone on the line who is asking about tasks and notes, go into their provider manual and the Part 1 Policy and Procedures Manual for all providers and read what the documentation on a daily service note should be. And I'm not trying to be mean. I'm trying to avoid you getting a massive audit payback. Because if we audit your agency and all you have done is done a clock in and a clock out time and say you provided PSS without a comprehensive note, we are going to recoup the money for that visit. And I don't want that to happen to our providers. So I am really asking with a lot of really concern for you guys as our provider community, that you go back and read not only what is in your specific provider manual associated with your specific services that you are providing outside of EVV and CLS, but you also go to our Part 1 Policy and Procedures Manual that is for all providers who provide services to Medicaid. There is a section that is specific to documentation of a service note. It talks about those requirements that are required for all specific providers. Please do me a favor and you a favor and read through what those requirements are. Okay, sorry. I just had a moment there where I didn't want a whole bunch of people to get in trouble for something because that's a perm audit error, a program integrity error. It's an error for everybody. So was your previous comment confirmation that paper, anything that is, I'm trying to be as direct as possible with this. So I'm not trying to speak in any kind of nebulous zone. So please don't think I am. Anything that is documented in the EVV system or your third-party system does not also have to be documented on paper. So that is correct. It doesn't have to be on a timesheet or anything else. It does not have to be documented on paper if it's documented in an EVV system. The next question is, if we enter a schedule for an individual, but there is a change in that individual's services tasks. Sorry, questions are coming in and it's losing me, and I'm sorry for that. So hold on one second. Find it. Sorry. Services task. The day manager does not have to tame the time. No, you don't. It is important to note, and this is a question that I've gotten a lot from some of you guys, that, and so we at Medicaid can't pay for uncompensated care, right? So what I've heard from a lot of providers is, and I'm just again going to be open and honest, I know we only got 7 minutes left, but I've probably heard this from 20 providers, that what you guys have been kind of doing as a standard practice is Brian works for Danette. Danette is my sister. So Brian works for Danette, and I'm scheduled for 8 hours a day. I get paid for 8 hours a day, whether I'm there 8.5 or 9 hours. Well, we can't authorize you to do that in Medicaid because you're shortchanging the worker who worked in the unit. So I understand that that means that you guys have to do a little bit of extra work, right? Because you not only have to explain to your staff member, hey, when you go over, that's extra time and you can't go over 40. But you also got to explain to the member, if I'm working 8.5, that means I'm only going to be able to work 7.5 another day. Because if I don't do that, I'm going to run out of the units on my PA. So it's really important that you have that kind of talk with your staff and the members to ensure that, hey, it's okay if you got to go over here and there, but that going over does impact you in a larger way, which means that you won't have the PA units on another day. I don't know how long it will take to get the approved cell phones. I've heard that they're working very quickly. Before I was out last week, I gave them the phone information to a member, and I got an email yesterday that it was drop shipped to them. It was a very nice email thanking them for having, essentially a new phone. We've only got 5 minutes. We'll take notice of what your demos on scheduling. You're asking for more demos. It's important to know that they do have regular weekly trainings on claims and an open session for you guys to attend where you can get these demos. You do not need to wait for the town halls for that. You actively need to engage in the training and go on to that website that is here in the chat that Brittany has had and engage the training so you can get these help with scheduling repeated visits and end dates. The resources are out there, so we want to make sure that you have that information.
Brian, just one other thing to mention is that we have the short videos too that are all recorded by the different functionality. So I know there's one on there on scheduling, so you don't have to go through and the entire training. If all you want is a quick refresher on scheduling, if you're on the portal, there's a training tab. Click on training, and then it will take you to a page where there's lots of different training content. And one of those is video tutorials, and it will give you 30 plus video tutorials on lots of different common topics. And I know one of those specifically is scheduling, and in 10 or 15 minutes, you'll get a refresher on scheduling.
Thank you. That is really good information, Joe. So we're getting close to time. We'll go back and review all of these questions. I did see one thing that came up several more times, and that is about missing modifiers. If there is missing, we have on the front page of the website now, the DCH website, all of the codes that are included. So you can go to dch.ga.gov, which is the main page, go to EVV, and on that front page, it's going to give you every single place that, every single code that is included. If you look in MMIS and that code is available for your clients and you cannot pull it down on TELUS, and it is one of the covered codes, then we will follow up with that and check and make sure. I've had staff today researching and working with staff. So you can feel free to call the call center with that or utilize the EVV mailbox, and we will assign DCH staff members to walk you through that.
And Brian, I just posted that link in the chat to all attendees as well. If you go to that page, it will, one of the first things you'll see is that list of modifiers as well.
Awesome. It gives you the list of everything. I was using it just this morning to crosswalk a member too who had called me on the phone here at work. Okay, so we're at time again. I know there's more questions here. We will go through those questions. Make sure they're included in the Q&A and do any necessary response. I really want to thank everybody for their continued participation and input, and I hope you have a great rest of your day. Thank you.